Thank you, Chief Secretary, and thank you, Permanent Secretary. And once again, I want to welcome you to this 12th Cabinet Meeting Decision Matrix. With me, I've got my colleague ministers who are there to answer all the questions you may have. I have Honorable, right next to me here, there's Honorable Professor Murwira, Minister of Higher Education, and behind there is Honorable Minister Nzenza, Dr. Nzenza, Minister of Industry and Commerce, and right behind there's Honorable Professor Mavima, Minister of Public Service, Labor and Social Welfare, and Honorable Obadiah Moyo, Minister of Health. And I think I've seen right on the other side there, my colleague Minister of Energy, Honorable Chasi. There's somebody else. Oh, you see now? Social distancing. And I do have also the Minister of Finance, Honorable Professor Mtuli Mbe. So your questions will be tackled at the end of the brief. Today, Cabinet considered and approved a report on the country's preparedness and response to the COVID-19 outbreak. And this was presented by the Chairman of the Ad Hoc Interministerial Task Force on COVID-19, Honorable Vice President KCD Mohadi. Notable progress has been registered with regard to the procurement of the requisite equipment for testing, as well as the protection of the frontline health personnel and supporting staff. Salient areas where remarkable achievements have been made include the following: the conduct of a total of 3,380 rapid result screening and PCR tests as at 19 April 2020, which is yesterday, compared to the 600 tests that had been done by the 14th of April 2020. The number of confirmed positive cases of COVID-19 stands at 25, which is up from 17 that had been recorded as at 14 April 2020. B, the receipt of a total of 4,499 rapid results test kits from Namibia on 15th April 2020 and their subsequent distribution to provinces. Furthermore, 6,000 additional rapid results test kits have been procured through UNDP, Global Fund, and INSCOP, with each of them availing 3,000 kits. And then 10,000 GeneXpert cartridges are expected into the country today, the 21st of April 2020, with a further 20,000 GeneXpert cartridges being procured by UNICEF to help in the rolling out of the testing for COVID-19 to provincial and district levels. Consignments of 18,800 extraction kits and some laboratory consumables have also been received from Jack Ma and the World Health Organization on 18th April 2020. And C, the partitioning of Parirenyatwa Hospital into red and green zones is 95% complete, while the renovation of the Beatrice Road Infectious Diseases Hospital has commenced with funding from INSCOR. 13 ICU facilities with a total bed occupants of 100 have also been identified across the country to take care of the projected 5% critically ill patients who may require ICU services. And D, the launch by His Excellency, the President of the Republic of Zimbabwe, Comrade E.D. Mnangagwa, of the 2023 call center at Newlands on 16th April 2020. Since the launch of that call center, a total of 3,800 calls have been attended to. Then E, authorization of an online education program, Ruziwo platform, by the Ministry of Primary and Secondary Education. This is to offer learning to pupils and ensure they do not regress while observing the COVID-19 lockdown. There is also raising by the insurance industry of an initial 1.5 million towards the fight against COVID-19, availing of free life cover to all health practitioners to the tune of a total of about 16 million by various insurance company worker. And F, the enactment of Statutory Instrument 90/2020 to control goods, general imports and export license of COVID-19 goods, as well as Statutory Instrument 92/2020 to regulate standards adherence in the manufacture and supply of personal protective equipment and materials. In view of the foregoing, Cabinet agreed as follows: that the COVID-19 testing program be expedited, commencing with all frontline personnel, and that has already started. That also, in order to meet the requisite number of tests directed by Cabinet of 40,000 tests by 30 April 2020, health testing units will be engaged to complement and or bridge the personnel gaps that may arise in the Ministry of Health and Child Care. That as this is a state disaster, all workers are compelled to provide service as required. And also that the agreed risk allowances, insurance, and other incentives be availed as per agreement. And also that daily statistical updates on COVID-19 status in the country, as well as the nation preparedness, be availed by the Minister of Information, Publicity and Broadcasting Services and Health and Minister of Health and Child Care. And finally, that discussions regarding the proposed moratorium on prices identified basic commodities, these were concluded, and announcements in this regard will be made in due course. Then there were presentations on 100-day priority projects. The first report was given by the Minister of Higher and Tertiary Education, Innovation, Science and Technology Development. Progress to date includes the following: completion of the final draft of the new agroecological regions map of Zimbabwe and review under the Geospatial, Aeronautical and Space Science Capability for Zimbabwe Development Program. Then B, the initiation of 30 innovation projects in established innovation hubs at UZ, MSU, Chinhoyi University, NUST is 100% complete. Then C, the establishment of industrial parks at UZ, CAT, and MSU is well on course and at 60%, 75%, and 45% complete respectively. And D, under the application of new cattle reproductive technologies programs, pilot artificial insemination of 93 out of 360 cows in Mwenezi and Cherezi has since been successfully conducted. Then the next 100-day priority projects report was given by the Minister of Health and Child Care, Honorable Obadiah Moyo. Progress registered includes the following: plastering and flooring of the newly built obstetric fistula unit at UBH in Bulawayo have been completed under the Super Specialists Hospitals program. Then B, the construction of an uninterrupted power supply unit has been completed at Mupilo Central Hospital and is now functional. C, the construction of the National Pharmaceutical Warehouse is 30% complete, with the hazardous substance unit almost complete and awaiting roofing, electricals, and other internal finishes. And D, renovations at the National Public Health Emergency Operations Center in Zimbabwe premises have been completed, with the premises now adequately equipped and ready for operations. Under the Ministry of Information, Publicity and Broadcasting Services, the Cabinet was informed as follows: pertaining the revamping of FM radio transmission in Mashonaland West, it was reported that a new transmitter had been procured the previous year under the Zim Digital project. And on the licensing of 6 new television stations and 10 community radio stations, Cabinet noted that an invitation for aspiring licenses to file the application with the authority was done. the project was expected to be accomplished by May 2020, slightly after the lapse of the 100 days cycle. Regarding the construction of massive mobile stage and public address system for road shows, it was reported that the system design had been completed, while the procurement and construction of system components stood at 60% completion, and that panels for the screen, as well as the wiring and cable of the outdoor public viewing screens, had been fitted. All the projects have been slightly affected by the lockdown. And also that the Zimbabwe at 40 documentaries were produced, and that was shown on TV on our Zimbabwe at 40. That actually gave an opportunity for Zimbabweans, especially the young generations, to understand the history of this country. And then the next presentation on the 100-day projects was done by the Minister of Home Affairs and Cultural Heritage, Honorable Minister Kazembe Kazembe. And the minister reported as follows, that construction of Chimoyo Block C flats ZRP is at 54% towards completion of the superstructure, and that decentralization of passport services to Chitungwiza District Central Registry currently stood at 20%. That also installation of a queue management system at Immigration Headquarters, Harare, is now at 40% towards completion. He reported that refurbishment of the visitor facilities at the Chiremba Balancing Rocks Monuments in Epworth, Harare, currently stands at 70% towards completion. And also that the project of converting an existing building at Girls High School into a community archive was completed on 27 March 2020 as planned. And finally, he reported that the construction of a waiting mother's shelter at Harawa Clinic, Zaka District, Masvingo, is 25% towards completion. Cabinet noted that the project could not be realized because of the delays or due to the COVID-19 lockdown. Then the next report which Cabinet received was given by the Minister in charge of Energy, Honorable Chasi. Cabinet noted with satisfaction the improved power supply situation, which can be attributed not only to reduced demand due to the lockdown, but also to the implementation of the demand-side interventions, such as the introduction of prepaid meters and also the unlocking of power imports following settling of debts. Cabinet also welcomed the farmer support initiatives that will guarantee agricultural production, especially now as farmers are preparing for the winter wheat program. I thank you sincerely.
Thank you, Chair. Now we have the opportunity to ask questions. So we give you the chance. I'll start from my left this time. Yes, Nicola.
Thank you very much. I've got two questions. My first question goes to the Minister of Health. We have around 9 days left before the 31st of April. We have a balance of around 36,000 on the target, giving us an average of around 4,000 to 5,000 tests a day. I want to understand from the Minister the work plan in achieving the 40,000 tests that the government set for itself by the 31st of April. And then my other question, I don't know, with indulgence, other countries have calculated the cost impact. This question in terms of finance. Other countries have calculated the cost impact of COVID-19 and the lockdowns. Has Zimbabwe done so? And is there a revision in terms of our growth prospects for 2020? Looking at we have spent close to 30 days by 3 May, which should be partially unproductive. What will be the cost impact, and also what will be our growth prospects come December 2020? Thank you.
Okay, thank you very very much.
Okay, we don't have anybody from the left. Right.
Good afternoon. My name is Maxo Tabatapa from Star FM. I just want to ask the Minister of Social Welfare. We have seen that 21 days have lapsed, and the people have been expecting government to give them at least a cushioning during this period. And last week you indicated by Wednesday people should have received their money. But now we are seeing days have gone and people are crying out there because of hunger. What is government doing to make sure that those people are cushioned on time? And also, maybe if you discussed the issue about the returnees, those who are coming from other countries, there's been an issue that those people are being subjected to environments which are not conducive, and they are crying out that government maybe should take them to better places. What's the government position on that? Thank you.
Okay. Yes, please.
What is the overall national COVID-19 testing strategy that we should see going forward with the resources that are being mobilized so far? This coming from a background that my colleague has just mentioned of the target of having at least maybe 1,000 tests per day, as previously mentioned in previous meetings.
Okay. Last.
And privilege, you are from which paper? Sorry, I just want to know you.
German International Broadcast.
And you got the question, Minister.
It's John Cassin, Channel Africa, SABC. The President is directed to the Minister of Health. It's on the request maybe for explanation. We saw some tweets from your ministry saying that the country is facing some malaria outbreaks. At a time the whole world is also battling with COVID-19. Some have already started saying that Zimbabwe could be focusing on COVID-19, neglecting other ailments like malaria, which are killer diseases as well. So how many people have died? How many people have been affected? And in terms of combating COVID-19 without overlooking other diseases, what are you doing as a ministry and government as well?
Thank you very much. At this stage, let me revert back to the chair.
Yes, John. Thank you very much, Secretary. And Kodisani, that's how you know. Kodisani. That's right. Thank you. He would like to know from you, Minister of Health, that you have, with this balance of 36,000 up to the 30th of April, and he says, what is the work plan to achieve this target? Minister?
Thank you very much for that question. Yes, we have a target, and that target is 40,000. And I emphasize it's a target. It's all dependent on the availability of samples. Right now we've been preparing for the testing materials, and we have those in place, whether it be rapids or the PCR. So testing materials is available, and I hope you realize that we expanded the clinical definition, WHO clinical definition, so that we'll be able to capture more cases. That's in hospital. We said all patients in hospital are admitted, they have the opportunity to be tested. Any case who is in hospital right now, we are saying to our clinicians they should treat it as a suspect COVID case. So that's the basis, that is the source of sampling material. At the same time, we can expand those numbers by giving the opportunity to all our healthcare workers. So that's a big number. If you look at the nurses alone, it's 18,000. So that's a big number. So we can target those, all the doctors, all the laboratory people, all the healthcare workers, their source of materials. And then we can even go further and request people to come to the hospitals for testing. You know, so there's all the opportunities to be able to increase the numbers. But my point remains that that is a target figure which we are hoping to reach, and we will try and get that, to that figure. The materials are there. It's a matter of ensuring that we have our testing scheme running smoothly and in place. So this is what is in place. We got the kits, the personnel are there. You know, we want to increase the personnel. We're also going to rope in, you know, the personnel from the army, from the medical personnel who are working in the army, who are working in the police, you know, prisons, you know, to come forward and give assistance in the collection of the samples. That is the key issue, collection of samples. Otherwise, everything else is in place. Thank you.
Thank you, Minister. And the next question is to you, Minister Mthuli Ncube. What is the cost of impact of this COVID-19 lockdown on our economy? And you also wanted to know whether there will be a revision on the growth targets. Minister Ncube.
Thank you. Who asked the question?
It was the same person, yes. You wanted to know.
Thank you for your question, as usual. Yes, we are working on the cost of the pandemic as we see things. It's not an easy exercise, I must say, because you see the channels of transmission of action are numerous. First of all, we have got the impact of the prevention measures in the first place, which is the lockdown. That's a prevention social distancing measure. And then there is a channel through tourism that, you know, that sector has been impacted by the absence of foreign travelers, and also the airlines which are not flying. That's one channel. The other channel is the global commodities. As you know, we are an exporter. Within the mining sector is the largest exporter. So that, again, commodity prices are being impacted by global demand, which has tanked. But there's an upside. The upside is on the price of oil. You notice that the oil futures yesterday fell even before zero, if you're watching those capital markets, which means that now oil companies will actually pay you to take the oil away from them, because there's no storage capacity. In future, that's what it means. So there's that positive impact. There's also a net oil importance. I could go on in terms of channels of impact. So it's quite a complex exercise. So we're working on the cost of that. We just extended by another 2 weeks in terms of the lockdown. We're factoring that in. We're able to share with you in the fullness of time what that cost is. Naturally, that means we have to revise our growth figures. What has been done so far for the whole Sub-Saharan African region is many people from the World Bank and the IMF, where they've said on average they expect countries in Sub-Saharan Africa to see their growth, GDP growth figure at an average of minus 1.5%. So those are also the growth figures that we kind of anticipate for Zimbabwe. They could be worse, they could be slightly better, but we should expect an impact. And again, once we've concluded on the cost of the pandemic, we will then to revise the growth figures and share those with you. So watch this space, we'll be able to come back to you. Okay, thank you.
Thank you, Minister. The next question was from Star FM. I didn't get the name. Maxwell, thank you. It's from Maxwell, Star FM. And this question is directed to the Minister of Public Service, Labour and Social Welfare. He wants to know that last week you talked about this cushion allowance, and now the 21 days have lapsed, and there are people complaining, they are crying of hunger. When is this cushion allowance going to be given? And maybe you can also tackle the next question from the same person on the returnees who are arriving, of course, and they are quarantined on arrival, and they are complaining about the environments in which they are staying being not conducive. What is the government's comment on that? Thank you. Honorable Minister, Professor Mavima.
Thank you, Honorable Chair. Thank you, Marco, for the two-pronged question. On the issue of cushioning, we have two programs that have been initiated for the urban areas. The first one is the Cash for Freedom program. You know that it was running in Arale and Bulawayo only. In both the metropolitan provinces, we continue to register people. In Arale, as of last week, we were at I think 11,000 people, 9,767. In Bulawayo, we were at 11,664 beneficiaries. And payments of $1,764,000 have been made in Bulawayo. In Arale, sorry, and in Bulawayo, the payment of $2,105,935 has been made. But we continue to register people in both metropolitan provinces, and we will continue to roll out. We have now moved this program to other urban areas, and we have started transfers in Lusape, in Kariba, in Kaloma, in Bindura, in Wange, in Victoria Falls, in Bay Bridge, in Plumtree, in Kwanda, in Pepe, in Vuma, and Shilumi. But we continue also to include other urban areas, and the registration is taking place. That's the Cash for Syria program. Then the COVID-19 relief program, which also is a cash transfer program, where we are giving $200 per head per month. We have now a database of 1 million people, 201,631 individuals whose livelihoods were affected by the lockdown have been registered from representations that came from the Ministry of Women Affairs, Community, Small and Medium Enterprise Development, and local authorities, as well as informal traders associations. So 200,000, I would say, have come from that database. Another 800,000 beneficiaries have been identified using a database that was given to us by the Ministry of Finance and Economic Development. And so we have a total of 1 million now. These have been submitted to Treasury for final approval. As soon as the final approval has been given, we want to give out the 200 test disbursements, which will mean that before the end of April, we will have disbursed 200 million for this month. There are provisions for May and also possibly for June under this program, targeting 1 million. So this program, we are now at a very advanced stage. As soon as we are granted the authority by finance, we will start disbursing as early as tomorrow. If that comes tomorrow, then we will disburse because the database is there. You mentioned the issue of returnees, and you are saying, some of them are saying the places where they've been put are not conducive for one reason or the other. Let me indicate to you what the basis of these complaints are. But you have to understand that Cabinet has made a decision to say even if ZTOwn has additional capacity, it is not proper to put new returnees at ZTOwn. We have to find other places where we can put returnees. Why? Because the ones who came to ZTOwn was clean and were found, those who are still there were found to be negative of COVID-19. If we bring in another group and put it in ZTOwn, a simple mistake of mixing these might actually end up infecting a lot of those returnees who were free of the disease. So what we are looking at here is to get as many places as possible where we can put people. And I'm glad to say that we are in the process of revising the time period we are going to have to hold people to maybe 8 days. If we can do what is known as PCR testing and people turn out to be negative, then they may be let go to their homes if they are negative, because that test is quite conclusive. So all those have to be taken into consideration. If there are problems, real problems that they already have just already, we are going to consider moving those people to another place. But we have to keep in mind that we'll be getting other returnees as soon as possible, and we may run out of places. So the returnees themselves have to bear with us. You can't expect first-class facilities when the country is facing a national disaster, which is what COVID-19 has been declared to be. So they have to bear with us. Some of the conditions may be minimal, be standard, but we are dealing with a crisis. They have to understand that. But we don't want them to be in spanning conditions. That's why I would be called to Belvedere to just look at those conditions. Thank you.
Thank you very much, Minister Professor Mavhima. I think that was really exhaustive. You are happy, I'm sure, Star FM. Then we go to privilege from Deutsche Welle, Health and Minister of Health and Childcare. I think you have sort of tackled this earlier on, but if I got him right, he wants to know what is the national strategy going forward with resources put so far.
Thank you very much, Chairperson. I just want to add on to what Professor Mavhima was talking about with regards to the 8 days. In order to ease the burden at the quarantine centers, Cabinet actually approved the PCR testing of all returning residents who are held in quarantine at day 8 from the day they were admitted at that quarantine center. And if they are found to be positive, they will be sent for isolation to an isolation center. And if they are negative, they will be released. So that makes life easy, and it decongests, the facilities. So that's the first issue. Then regarding the issue of the strategy which we have, I think I said most of it, but I will handle it from another angle, that is of the distribution of the centers. The intention is that we have testing centers right through the country. Right now we've got the Harare, where we are doing the testing of PCR testing, and also in Bulawayo. And now we are awaiting, as indicated by the chairperson, there are some kits which have arrived, for our gene experts, PCR machines. So those will be at the provincial level, starting with the first 13, which is the 8 provincial hospitals, plus the 5 central hospitals, making a total of 30. And then from there, we'll cascade down to the district and to the clinic level. So that's the strategy. We want to be able to make it easy for the population to be able to walk in the shortest distance possible to be able to access a testing site. And then, as we also move, we have some mobile testing platforms which we will also be putting into use. So we want to expand as much as possible our testing capability. So that is the main strategy that we have. Have as much sites for testing as possible. And this will allow us to be able to capture more numbers. As we have more sites, more people coming through, and more numbers. And at the same time, we'll also be able to ensure that the number of tests that we have are also increased. So, thank you.
Thank you very much, Minister Obadiah Moyo. And the next question is also directed to you, Minister of Health. This was from, was it Musekiwa today? It's Tenikasim. Yes, SABC. And Minister, he wanted explanation as to the tweets. He saw that the country is facing malaria outbreak. So he's worried that, and would like to know whether because people are all focusing on COVID-19, possibly neglecting other diseases. And he also wanted to know how many people have died from this malaria outbreak. Minister?
Yes, the issue of malaria outbreak is for real. This happens to be the peak of the malaria season, as usual. And I have to also indicate that the burden of testing, which normally takes place during this period, is also being hampered by the COVID-19. We now know that from the past, what used to happen, what normally happens is, we'll have all our teams going out to test for malaria and to make sure that the people who might be positive for malaria receive their treatment. So right now, what we're experiencing is a slowing down in that process. So we're getting all our teams out. So far, we've lost about 152 people due to this malaria, right through the country, not just in one area. So it is an issue which we are tackling, and I'm sure we'll be over it. We'll be over and above it very shortly. So the malaria season is now, and this is the time when most of the people, get affected. So we would expect that rise, in malaria cases. Thank you.
Thank you, Minister. Chief Secretary.
Thank you very much. Okay, now we come to the second part and last part. Right at the back. Who are recognized.
All right, thank you, Takuchi Mbake from Zimbabwe TV. My first question goes to the Minister of Social Welfare. You highlighted that you are going to be giving people $200, but given the inflation rate and things on the ground, $200 is not enough to get basic commodities. So is it not also prudent for government to consider giving out food hampers to the affected people on your list, in as much as you might complement them with the $200 a head? Because we heard from the President 2 weeks ago that there's going to be a revision of the budget. So with the monies being revised towards fighting COVID, can you not then also supplement the $200 with food hampers? Because $200 cannot get you much with a 2 kg packet of rice going for $100. And then to the Minister of Industry, I wanted to find out the moratorium that the Minister of Information just told us about regards the basic commodities. going to be structured? I know she didn't tell us about the basic commodities that are going to be covered. How is it going to be structured so that it does not affect supply? Because at times when we get to points where government interferes in pricing and supply, you then have these challenges of accessing products. So how are you going to work it out to ensure that you don't have shortages of these basic commodities? Thank you.
Okay. At the back.
My name is Tafazo Kofa. I'm a freelancer. Is government monitoring the distribution of raw lamine? Is corrupt tendencies now common at the distribution points? And at times it is alleged that security forces are the perpetrators of the corruption at the delivery points. And my second question also goes to the Minister of Social Welfare. Is the ministry or government considering another way of distributing the raw lamine? Because the current one, social distance is not observed at all. Thank you so much.
Okay. Right, you.
My question goes to the Minister of Energy. Like the Minister of Finance has said, the price of oil on the international market has been falling down since probably the emergence of this pandemic. And we've seen in the past week or so the price of fuel going up in Zimbabwe. And the Minister, one of the tweets, promised to give an explanation as to what was the reasoning behind that increase. And second, I wanted also to find, maybe if you could explain the reasoning for that increase. And also what government, in some previous briefings, he has indicated that government is trying to put in place mechanisms to regulate the liquid petroleum gas industry. And wanted to find out what has been put in place so far. Because there's also been an astronomical rise of prices in that area.
Right at the back.
A privilege, DW News again. To the Minister of Energy, how are we taking advantage of the fall in oil prices to stock reserves, seeing we are a net importer of fossil fuels? The prices internationally now, they are beyond zero. So we could take advantage maybe of building reserves when prices are down.
No, there is one at the back. I'm not going to repeat with so many.
Thank you. My name is Owen Manova from JPC. I can see the Minister of Education is not around, but my question relates to the issue of the e-learning platform that Minister Otsonga talked about that has been introduced by in public. I just want to find out how it's going to be working. Is it a platform that is going to be accessible to all pupils across the country? What are the modalities in terms of implementing that one?
Right. Right, you are the last one.
Thank you so much, ma'am. My name is Anyway Yotam. I'm a freelance journalist. My question goes to the Minister of Home Affairs and the Minister of Health. We are now in 4 weeks of lockdown, and at our security services checkpoints, there is no ablution facilities. What is going on exactly?
Okay, on that note,
What's going on? All right, thank you. Okay, thank you very much. Yes. Thank you very much. I think we started with Kufa, right? And the question was directed to the Minister of Social Welfare. Thank you very much. I think we started with Kufa, if I got the name right. And the question is directed to the Minister of Public Service, Labour and Social Welfare. The question is government monitoring the distribution of mealie meal? And the next question, maybe since Honorable Kazembe is here, security forces are perpetrators. That's what he has said. And also back to Minister Mavima. He says, is your ministry considering another way of distributing mealie meal? Because the way it is happening right now, social distance is not being observed. Minister, I'll start with Minister Mavima.
Thank you, Honorable Chair. But you disregarded the Takuchi Ambape's first question, which was about food.
Yes. Tako, I didn't forget you. I have your question. It's okay. Handle that one from Kufa, unless you want to start with Kufa.
Yeah, that was the first question.
Yes.
Taku, the issue of food governance has been brought up many times over by a number of people. We are currently giving $180, and indeed it doesn't cover much. What the idea was with the $180 was it was going to be able to access subsidized development. But we have a number of issues related to that. You know, the supply side has been very limited, and people cannot access. In many places, they cannot access the subsidized development. To add on to the 180 requires additional resource allocations. Even if we say, let's do a food hamper consisting of sugar, salt, and other things like that, there are resource implications there. And a discussion has to take place within the constraints that we have, fiscal constraints that we have. It has to take place with my colleague minister in Treasury. We also have to consider the logistical issues related to delivering food hampers to every household. Again, you know, it's something that we are considering. We are also working on issues related to the supply by our own side of foods, private limited, which is wholly owned by GMB. If we can boost supply from there, then it means we are able to ease on the pressures, especially on development. And then maybe we can free up some of the money that we are currently giving to people to buy a few other things. So these are all issues that we have to consider. But the resource envelope has to be sufficient for us to go and do a food hamper. And then we have also to consider the logistical aspects, including the cost of moving whatever food hampers from the place of production to the families. All those have to be taken into consideration. The issue that whether government is monitoring the distribution of roller meal, I am assuming that this is roller meal that is coming from supermarkets, which is really outside the purview of social welfare. What is required there is probably the enforcement of social distancing, and also the enforcement to make sure that there is no arbitrage that is taking place or some rent-seeking behavior that is taking place there. This is beyond the Department of Social Welfare. Where social welfare comes in the distribution of food is where we are giving 50 kg bag and also the Minister of Industry and Commerce who are here can shed more light on the distribution in supermarkets. Again, from our perspective, if we unlock more delivery coming from side of food of Roland, then even the issue of social distancing can also be addressed. Because in this particular case, you find people really congregate in one place and want to be the first to get into that supermarket. But if they know that there is sufficient supply, then we may actually ease up the congestion. And we are working together with the Honorable Minister of Finance and Economic Development and Honorable Minister of Lands and Agriculture to make sure that we have ramped up production within side of it. That announcement will be coming very soon. Thank you.
Okay, I think I want to go back to Minister of Finance if you have got anything, because Taku was wanted to know whether there will be also a revision of a budget in terms of that allowance, that cushioning allowance. If you can come in, and then later I'll go to the Minister of Home Affairs and Minister of Industry and Commerce. Thank you.
Thank you, Mr. Nzangwa. Two things on the $200 cash transfer allowance. Whether we revise it or not, or need the other one, which is 180. I think something with 180, which was for in lieu of cereal. No, you see what's happening is that in fact we're going to move in target in a way. So to the, let's say, 10,000 people in Harare, we have extended $180 per person in lieu of dollar mill to cover their dollar mill needs. But what's going to happen is when we start paying out the 200, which is in the next few days, the same individuals are also going to benefit from that. So actually you have an overlap where the person will get the 180, and in addition to that they get the 200, and that will make 380. But of course the 200 is only for 3 months, so that was meant to cover the COVID-19 impact. While the 180 is permanent. So then after 3 months, or even earlier, we again look at those figures and see if we can push them upwards. We remain flexible, frankly. And of course, the issues really are ones of budgetary constraints. But we remain flexible in terms of really looking at those numbers. But in the meantime, we know that there's overlap. So they're in fact going to be received in 380 rather than just 180 or indeed the 200 as the two together. That overlap. Maybe just one footnote on the selection of the 800,000 people, I'm sorry. Within that 1 million who are receiving the $200 per person. We've used quite a detailed approach to get into this figure, I can tell you. We've used all manner of methodologies from different angles. For instance, we've actually looked into the accounts of the so-called value. We literally did a database of 3.5 million people. We looked into the accounts, checked the movements of the funds, so that we could get to those that really need the support in terms of what's in the accounts, movement in the accounts. And we've used data from the banks as well as data from the mobile banking platforms, and they cooperated with us very well. Secondly, we've also checked where these individuals live using GPS information. We know where they were 1 minute before the lockdown was declared because we have their mobile number. So we know where you live. So we're able then to see if the movements in your account are low and we think you qualify for the $200, but you live in Glenlawn, that doesn't mean you deserve the $200. So we have to know from where you live that I have a problem, we need to adjust. So we've been quite sophisticated. Thirdly, we've also taken the information of where you were at midnight before the lockdown, 1 minute before, we've mapped it onto, or rather used satellite information imagery to check where you really physically live. Okay? And then fourth, we've taken data from Zinstats, population surveys and so forth, so that again we've got a fair distribution of beneficiaries across the country. We've been very sophisticated. And we run an algorithm that optimizes on all these variables. It says, A definitely deserves the 200. But in short, that's what we've done. And we'll continue to do more, I think.
Very sophisticated indeed. And now I want to come to, I'll end up with the Minister of Home Affairs. Minister of Industry, Dr. Nzenza. Of course, you need to explain about the distribution of food into the supermarkets. But Taku also wanted to know about this price moratorium on prices on identified basic commodities. Which are those? And although we said the announcement in this regard will be made in due course, but if you have information which you may give, Taku would like to know. And also, his worry is, will we continue to have stocks in our supermarkets? We don't expect empty shelves. Then you can tackle it together with the distribution of food chain. Thank you, Minister.
Thank you, Taku, for that question. Without doubt, food prices have been going up a lot from last year, and they've continued to go up. When the President announced the lockdown, the food basket went up again. This escalating prices has continued to impact on the consumer, who's at the end of the value chain. The basic commodities that have continued to go up include bread, sugar, cooking oil, meal, flour. Let me give you the figures. In February 2020, the bread basket for a household was $4,656. On April 11, the Consumer Protection Affairs and the Ministry of Industry and Commerce did a survey, and the bread basket had gone up to $6,660. This causes a lot of pain on the consumer. We have met with the suppliers and the producers. This was a multi-sectorial meeting which was held on the 11th of April. And the people involved are those who produce, manufacture, and distribute food. The aim of that meeting was to put our heads together to see how we can protect the consumer. The people who attended this meeting include the Grain Millers Association, the Confederation of Retailers, and others. We came to an agreement which still needs to be announced, and we intend to make the announcements together with them in due course. Now, regarding supply, during this meeting that we had, it was agreed that the producers will continue to produce food on the shelves. Now, the second question regarding the roller mill. We have been monitoring again the grain subsidy program. Yes, admittedly, there have been some hoarding. However, we have a solution and an example. And this example is seen in the township of Mengere in Rusape, where during this time of the lockdown, what has been decided by the retailers and the community is to register each household for the grain subsidy. And then the supermarket, Penmat, for example, goes from door to door and delivers the roller mill 10 kg at $70. So we intend to replicate this example to stop hoarding and also profiteering by unscrupulous vendors. Thank you.
Thank you very much. I think you've also dealt with that question from Kufa, the freelance, who wanted to know other ways of distributing meal and observing social distancing. And I think that example which you have talked about will cater for that. Now I come to you, Minister Kazembe Kazembe. We know that you are doing a great job working together with the Ministry of Social Welfare and making sure that at least people continue to go out there with doing the essential services. But Kufa, a freelance, says some people are saying security forces are perpetrators, especially when it comes to the distribution of mealie. Minister?
Okay, thank you. Thank you, Honorable Chair. Let me start by adding on to what my colleague has just said, Dr. Nzenza. Yes, indeed, we are working together with the ministry to ensure that, especially the roller mill gets to the people. In fact, contrary to what has been doing rounds in the media, it is government that directed that security agents must ensure that roller mill gets to the people. This was after the citizen had complained, similar complaints that were raised by the journalists, that some are overcharging and some are holding. Let me make it very clear that the statute instrument, I think it's 83 of 2020, or I'm not really sure of the number, but it's prohibited to hold the subsidized roller mill. It's also prohibited to charge at a price higher than the stipulated $70. So it was the government's directive to ensure that the roller mill gets to the people. So we're working very well, and it has been explained clearly by my colleague here. And then the issue of alleged corruption, or whatever it is, by the security agents. Look, the security officers are people. If this is happening, please, we always appeal to the citizens that let us know. We do not tolerate corruption, neither do we allow our people our police officers or security agents, in total, to be involved in these things. But again, it does happen. So we kindly appeal. In fact, in my view, the best police officer is the public, because you are the people who see these things happening. So we're appealing to you to tell us if this is happening. But otherwise, we are doing our utmost to ensure that roller mill gets to the people. And I want also to say whatever the minister has said, what is happening in Manika, it's commendable, and we are looking forward to ensuring that we do the same in all the other provinces. And then I think the other issue which was too directed, a bit harsh. No abolition facilities, what's going on? Yes. Yes, there are no abolition facilities in some roadblocks. Roadblocks, by their nature, they are not permanent. They are always, it's either they are here or there. But what I've also observed, I've been moving around. Some areas where the roadblocks have been permanent, they are abolition facilities. I'll give a very good example. As you drive towards Mazoi, right before or around the toll gate, or even after Mazoi, they are abolition facilities. But I agree that there are some areas where we do not have abolition facilities. But like I said, these roadblocks are normally temporary. That's why also they rotate the people. We find they're always changing. We have 5, 6, 7 people at every station so that they can always rotate. But however, it's something that we may want to look at as well, to see if in certain areas we cannot have those mobile ones. I would like to thank you for your questions.
Your chair had not gone to that question as yet, but anyway, thank you for answering it. Yes, that's all right. Thank you very much, Honorable Minister. And the next question was from Farirai Herald. And this question is directed to the Minister of Energy. The price of oil has been falling down, price of fuel going up in Zimbabwe. What is the reason for that increase? And also, earlier on, there was a report that there will be mechanisms which will be put in place to regulate liquid gas, because there is astronomical rise in prices of liquid gas. I think this question, you can tackle it together with the question from Deutsche Welle, who was also asking about what are you doing? Are you taking advantage of the prices, which are low internationally, to build reserves? Honorable Minister of Energy.
Thank you very much. Thank you very much. I think I have to start by saying that, broadly speaking, when we speak about fuel, there are broadly speaking, two determinants of prices, which is the FOB, which is international, and then we've got our own local conditions, which add onto the FOB. Now, our own macroeconomic situation comes into play here, in particular the exchange rate. We have taxes, which are not determined internationally, but which are local matters. Those determine eventually what the price is. Of course, the complaint is that the price of fuel has gone up, which is true for the reasons that I've indicated. But we also need to understand that given our own situation, we are still at the bottom of the pile in terms of the cost of fuel to the public regionally, creating opportunities for arbitrage. I think you are all familiar with these issues. Now, at the international plane, we've had a very novel and key development where we've experienced for the first time negative crude oil prices. This has never happened before, and it's explicable in two respects. First of all, geopolitical issues affecting Russia and Saudi Arabia, and of course the Cardiff situation, which has reduced demand. So they are in a situation where people have forward bought fuel and they don't have storage for it. And so you find that the producers are now, even as Professor Nolo has correctly indicated, they are now even paying the buyers to take the fuel. So the disharmony that is unprecedented has resulted in producer incoherence, particularly between Saudi Arabia and Russia. And so that has resulted in instability of the prices. We don't know how long this is going to be in place and whether it will be sustained for a considerable period. But what I can assure you is that as a government, we expect that those that bring in fuel will seek to ensure that the public of Zimbabwe benefits from the pricing that is existing at the moment. And so we will take every necessary action to ensure that we don't have people pretending that they are buying at very old prices, and yet we have actually been in a situation where prices have gone negative. We will, of course, keep watching the situation and with a view to ensuring that where we can take advantage in terms of buying at current prices, we'll do so and pass on the benefit to the public of Zimbabwe. We will, in due course, advise you of what those steps will be. The area of gas is a matter of serious concern for us. The spirit of profiteering, which is now endemic in the country, is a matter of concern. Some players in this sector seek to take advantage of the power situation. They know that the public, some may not afford the power, or it may not be available at certain times. And so the pricing has been informed by the spirit of profiteering. We are currently engaged in discussions with stakeholders and coming up with the relevant policy and regulatory framework to deal with a variety of matters, including standardization of equipment and standardization of the gas itself. There are many things that are happening there. People taking this and that and mixing it and selling it to the public. So we have a lot of matters that we are addressing there. Thank you very much.
Thank you. And this one. And the last question was from Owen Mandova from ZBC. Excited, he wanted to know more about the e-learning platform. I want to say the committee of the task force has already been informed about this proposal to introduce this online education program that will keep learners learning and ensure there is no regression. We know our kids have been out of school for so many days, and there's another 2 weeks extension which has been done. Certainly, we feel that this Resuo platform, which is being offered by Higher Life Foundation, it is it will benefit a lot of our children in the country. So in terms of the modalities which we wanted to know, that we will be giving that to you in due course as soon as those modalities are put in place. I want to thank you. I think that brings us to the end. Anyway, your question had been dealt with by the Minister of Home Affairs. Unless there's anything burning, we have come to the end. The Chief Secretary, if it's burning, it's okay.
I guess thousands of Zimbabweans, millions of Zimbabweans were waiting for this question.
Okay.
I like that. You are representing millions.
I'm representing them.
Okay.
Okay. Did the cabinet discuss issues of rentals? Because I know it had been 4 weeks without going to work. A lot of people, they have no money to pay their rentals. So did the government discuss anything on that?
Government didn't, but I think the chair
certainly
the latitude.
No, certainly you are right, Chief Secretary. That was not discussed. Yeah, that wasn't discussed. Thank you for representing. We are all representing. We are all representing the masses, and thank you once again. And I first want to thank my colleague ministers. So thank you very much, Chief Secretary and Permanent Secretary. And I think before you go, I want my Permanent Secretary has something to say. We appreciate you coming. You continuously come to this post-briefing so that you brief the masses, as you rightly say. And we, as the Ministry of Information, Publicity and Broadcasting Services, do really appreciate that. And we want you to stay safe, social distancing, and also the issue of masks is very, very critical.
Thank you very much, Honorable Ministers. You have represented the masses very well. Colleagues, we politely ask other Honorable Ministers and obviously the Chief Secretary that they may leave the room. It's okay. They remain with our partners from the media sector.
Okay. Thank you. We will take leave.
Thank you.
See you next time.
Thank you.
Okay.
Thank you. Thank you. And those ones are already leaving.